So we're gonna talk about the cells. We're gonna talk about how many cells we have in the body, and we're gonna know today. We have to know their functions, what they do. Okay. If you know what your cell does in your body, you should be able to apply it when you come to your disease, when you come to the pathophysiology of the disease, and also how the cells keep the body on equilibrium. So if you don't have balance, you're not going to be able to work straight. So if you have a good equilibrium, that means everything balanced, you should be a healthy young woman, a healthy young man. You should be able to do all of your activity of daily living without no problem normally. So that's the reason you need to know the cells, what they do. So how many cells we have on your body? Different cells. I believe we have your red blood cells, your white blood cell, your neutrophil, your muscle cells. You have your skin cells. There's cells who's in your skin. Those cells, they have their own specialties. So if I'm burned, these cells are burned. Do I have feelings? No, because the cells are burned. Because cells carry messages. They burn. So your nerve ending, if they burn, they're not going to receive message from the brain. So that means they burn. So how many type of cells we have in the body? How many we have in total? 12? Mm-hmm. Okay, so you know them. If I was you, you have to know them by heart. Mm-hmm. You can't just say you have 12 cells and you don't know what they do. We're going to talk about red blood cells today. So, Debbie, how many cells we have? How many type of cells we have?
We have 12.
Okay, I hope you copy them down because we're gonna go one by one.
Yes, I'm listening to you.
Darling, I'm asking you to copy them down. I'm not asking you to listen to me.
Okay.
You gotta copy them down that we have 12 different cells in the body.
Yes,
so if we have 12 different cells in the body, we need to know what they do. We're gonna start with red blood cells. Mm-hmm. Okay, go ahead. Next page, red blood cells. Use this one over here, red blood cells. If, now I want to know what the red blood cells does. First of all, before we talk about the red blood cells, let's talk about cells in general. Mm-hmm. What cells compose of?
It has...
Tissue?
No, not that. The nutrient that's in the middle.
Red blood cells, it's a membrane.
Yeah.
So, the liquid inside. What is inside the liquid? Darling, if you guys don't study, I'm not responsible. So, I'm not responsible. I do my job, but you have to do yours. So, inside a cell,
the protein.
That's not the protein, the jelly. The jelly inside the cells. You have notes. Where is it?
Right here.
Okay, what is the jelly inside? The cells membrane have what? Genetic. What after they have your genetics. Mm-hmm. Your genetics, what caused you to have sickle cell anemia is inside your cells.
Yeah.
Genetics, what caused you to have cancer is inside your cell because my grandfather have it. That means I inherit this from someone in the family. What else they have?
It has the proteins, the nutrients, the oxygen, everything.
Regular cells don't have oxygen. That's the reason you have type of cells that each cells have a job. So when you guys study it, you let me know because you guys have it. You went home. It's like 7 days. You guys should be able to know it. So now I'm going to move on to red blood cells because I'm not going to stop in one thing and keep on doing the same thing over. I'm not here to study for you guys. I'm here to show you how to study, and I'm here to give you the information to know it and then move forward. So, Debbie, what is in the cells? What do you find inside the cells?
It's composed of nutrients for
I told you that? Me told you that? Wow.
Okay.
Darling, I'm going to be very honest. If that's the way you guys are going to study, it's not going to work. Me tell you that? Okay, let's talk about red blood cells. Red blood cells is a type of cells. Remember, we have 12 or 11 cells. 12. If you have 12, we're going to talk about red blood cells. The red blood cells, they're red. The red, totally red. Inside the red blood cells, the reason they're red is because they transport oxygen. They're not dark. Red means oxygenation. The blood is oxygenated. So they transport oxygen. That's the reason they're red. So if they transport oxygen, how they do that? The hemoglobin inside, and we know oxygen is a nutrient. Oxygen is the energy. If you don't eat, you don't have energies. So oxygen, the red blood cell is vital. The reason it's vital is because the red blood cell transport nutrients, transport oxygen to the body. That's the reason it's red. Red means it's oxygenated. If it was dark red, there's no oxygens. So now, what is the normal red blood cells? Now you got to look it up. Normal red blood cells.
The value? 4.2 to 5.4.
That's it. Normal red blood cell is 4.2 to 5.4. Do you think the Board of Nursing gonna ask you for the normal values of red blood cells? I don't think so, but you need to know it. The reason you need to know it is because if I am talking about red blood cells, the norms, and I know the job of the red blood cells, I know it's vital to my body. So I know red blood cell carry oxygen. I'm gonna concentrate it in the normal. It carry oxygen, so I'm gonna carry the hemoglobin is in there. Hemoglobin is what? It's blood, red blood cells. So I'm gonna focus on the hemoglobin. That's what I'm gonna do. So what is the normal hemoglobin? Darling, please, okay? I'm talking about normal hemoglobin, please. You have those notes for the past 2 weeks. Come on now.
12 to 18. Oh, sorry. I remembered it, but yeah, I need to remember.
Okay, so. So the normal hemoglobin is 12 to what?
12 to 18, but 12 to 16 for females.
Okay. 12 to 18. Okay, so now. So if your normal hemoglobin is 12 to 18, what we discuss? We discussed that hemoglobin 12 is a vital thing. And then why hemoglobin normal for us is normal? Why for women?
It's normal because we have a period.
That's it. So that means I'm looking 12 to 18, but I know men should go up to 18. Women don't have to go up to 18. If we have normal hemoglobin for us is 12 to 18, anything below 12 is abnormal. That's all I know. For men, anything below 18 is abnormal. Anything below 18 is abnormal for them. If it's below 18, it's abnormal because he has to be, 12 to 18, and we're going to look at the parameters. I'm looking at 12 to 14 for girl, and I'm looking at men 14 to 18. You understand?
Yeah.
We talked about this before. So now, so do you see the importance why you need to know your red blood cells? Because the red blood cells have the hemoglobin. Hemoglobin is what? If your hemoglobin is low, what happens to you?
You'll basically die over time. Or sickle cell, or just
Darling,
other disease.
If your hemoglobin is low, that means your blood count is low. You need to replenish it because hemoglobin carries oxygen to the body, which is the nutrients. You're not gonna die. Because if you said you're gonna die, that means you're not a prudent nurse. Because if I'm looking at my patients, the hemoglobin is like below 12. I'm gonna go to the doctor and say, Doc, what are we gonna do? The doctor needs to do the corrections by administering blood. But on the board of nursing, if my hemoglobin is low than 12, the board of nursing is talking about something else. Maybe you need to ask the patients to eat, to boost, you ask the doctor to have the patient take iron, vitamins, eat a little bit better. So, to boost their hemoglobin. So, this is the importance of the red blood cell. If I was you, I would draw a red blood cells. And I will put inside the red blood cell the hemoglobin. And I will tell myself the red blood cells controls volume. Red blood cells control volume, blood volumes. Control blood volumes, so. Okay? It control, yeah, because if hemoglobin, the red blood cell, remember all the cells supposed to be round, smooth, no rough edgings. The reason you want them to go straight to the vessels. The vessels is the same as, what do you call that? It's like, in Haiti, they call it, there's a way they call it in Haiti. It's like, rigor. So you gotta go smooth. It shouldn't have no branches, in there that, interfere with the red blood cells when it's going.
With the transport.
Yes, it has to be smooth. It has to be a smooth transport. So if there's any interference, the red blood cells, if there's any interference, what's gonna happen? The red blood cells gonna be trapped. And then guess what's gonna happen? The lower extremities is not getting the oxygenation needed. The cells, they can talk. What they do, they will cry for help by giving you pain. They have a lot of pains. So if you have a lot of pains, there's something, it's a problem with your circulations. So other cells, next page, other cells that you want to talk about. Your platelets. I want you to look up your platelets. So, your platelets. Normal platelets supposed to be what? 150 to what? To 450 now?
400,000.
450. It's 150 to 450. So now you want to know what platelet is the cells. I don't care what people say. You need to be round, you need to be soft, but it carries different elements. Okay, so now we know platelets is an anticoagulant. If I was you, I would put platelet 1 is an anticoagulant. So I want to know what is the job of an anticoagulant inside of platelets. What did you find? Look to see what you find inside your platelets. Inside your platelets.
Form blood clot.
Okay. Okay, so now I will put, darling, finish read it, understand it, and then you're going to put it down. Writing the information, not studying it, is not going to do anything for you. So if my platelets cells, they carry anticoagulants, I want to know what that means. They prevent blood, they're supposed to be preventing blood clot. But if my platelet is not working properly, they cause blood clot. So I know inside my platelet, I'm going to find it's the clotting factors. Platelets carry clotting factors. So now, so look, because it seems like you're reading your platelets wrong. What did you find, Abby?
It says it's great.
I thought places. 1 second.
It's not insert, darling. You got to read it and put it in your own words. I'm not going to repeat it again. Put it in your own words. In your own words. I don't want to hear what the book said. Darling, it's not, it says, put it in your own words. You need to learn how to put things in your own words. It's not going to work. Yeah, go study it and let me know in your own words. So go ahead. What do you, in your own words. You got to read it and understand it and put it in your own words.
Yes.
Hey, but if there's no, you know, I'm not, what do you call those people? I'm not Petit Larousse. I'm not the encyclopedia. Encyclopedia will tell me big words. I don't understand it. I need to break it down and put it in my own words. When I put it in my own words, it will stick in my brain. So that's how it works.
So it come together with other platelets to form a clog, or more like, in order for the vessel to stop bleeding, it it's like a little stopper.
Okay, this is what platelet does. That's the reason they tell you scientism, the scientific people, I don't know them. They tell me the normal platelet in my body is supposed to be 150,000 to 450,000. If it's higher than that, I have a problem. If it's higher, what do you think will happen?
Clots.
If it's higher?
No, bleeding.
So see if you're, darling, look it up. If your platelet is too high, just put if my platelet is too high, what's going to happen to me? That's how it will say it. If you know your numbers, if you know your values, your blood values, if you know all of this, the board of nursing exam is supposed to be easy. You understand?
Yeah.
When this is what you do. Normal platelet is 150,000 to 450. If normal platelet is 150 to 450,000, I want to know if it's higher than 450, what will happen to me? That's what you need to find out. What will happen?
Blood clots.
Higher than 450?
Yeah.
Higher than 450? The patient will have a stroke due to the clotting factor isn't working. The blood is clotting. And guess what? If the blood is clotting, please. If the blood is clotting, living fair yon bull. The blood is unable to circulate it inside of vessels. Where do you think the blood clot is going?
It's going to go to your heart.
In your brain.
It doesn't matter. No. The first place the blood clot is going is your lungs. Because you're going to try to breathe. It's going to travel to your lungs. The next place is your heart. For the blood clot to go to your brain, this is a problem that you have for a long period of time. Guess what? Because the blood, for some reason, the lungs compensate. The clot goes to the lungs, go to your heart. The heart shoot it to your brain. Okay? So, if it's lower than 150, what's going to happen? So now I want you to go back to the red blood cells now. Go back to your red blood cells. Because you guys are not studying, and I feel like, I'm doing too much for no reason. You guys don't study because you went home with the paper. You come back, and then you guys don't even know how many things. Oh my God. Whew.
We didn't review it before.
You gotta review. No, not this, but your
I
hemoglobin.
understand with the hemoglobin.
Okay, now. So now, since I know normal hemoglobin is 12 to 18 between female and male, and I know female always on the lower side, I'm going to be on the 12. How you do? Yeah, your noise. So, guess what? Men under 14, I'm going to be concerned. Because female supposed to start 12 is fine. 12 to 13 for female is fine. 14 to 18 is good for men. But if a man is lower than 14, I'm going to say, something is cooking. I'm going to investigate. I'm going to ask the doctor to investigate a little bit more. So now, if I'm going to ask the doctor to investigate, now I know my red blood cell is so important. My red blood cell governs the hemoglobin. So because it's inside the red blood cells with our hemoglobin that carry oxygen to the body, the oxygen which is the nutrients. So now I know if my red blood cell is sick, my red blood cell is abnormal. If the normal one is 12 to 18, is it lower than 11 or higher than 18? I have a problem. So lower than hemoglobin, lower than 12, what is it? Look it up. Hemoglobin lower to 12, look it up. So, listen, I want you to get to that habit. When you read something, don't read the first word and just try to make sense of what they tell you first. You read the first time. Darling, please. You read the first time. You read the first time. You read the sentence again the second time. And the third time you put it in your own words. So now, if I know the importance of my red blood cells, I should be able to understand when the board of nursing address the red blood cells on the questions. If they address hemoglobin, I don't give a shit if I don't know what they're talking about. I know what my hemoglobin stands for. Based on that, I'm going to answer the question. You understand?
Got you.
You got it?
Oh. I really don't, honestly.
So now, if you're unable to explain a young kid about red blood cell platelets, that means if a kid, let's say, usually they said you should be able to explain to an 8-year-old. An 8-year-old comes up to you and said, "Oh my God, I'm bleeding. I think I'm gonna die." You know what you're gonna apply with them? No, you're not gonna die. You're talking to me. You're not having any shortness of breath. You're not gonna die. But let me put pressure to see if the bleeding gonna stop. If the bleeding does stop, what do you think affected? The platelet. That means the platelet is the clotting factor. That's the reason you need to know how many seconds you need for a patient to clot if you're not on any anticoagulants. So now let's go back to platelets. So now, because the board of nursing is asking you, if somebody is bleeding, I put pressure. If it's not arterial, if it's a vein, I should be able to stop the bleeding. If it's arterial, they gotta go to the OR. There's a repair need to be done. If it's arterial. Or if the vein is severely detached, they have to go to the OR because there's a disconnection. If there's a disconnection, they need to suture. So now, let's see about the platelet. Okay? Let's see about the platelet. Okay, so now we know platelets normal is 150 to 450,000. Higher than that is a stroke. Lower than that is severe bleeding. So now, darling, make sure you understand it. Don't write it, because if you don't understand it, don't write it. Let me tell you what's gonna happen now. If it's higher, I know my patient is in a severe trouble. I need to call a stroke code, because if the patient's platelet is high, so the doctor need to investigate a little bit more, and I'm assuming there's a clot somewhere who need to be bust. Break down. So you need, okay, how do you find if the patients, how do you find is your clotting factors that inside your platelets, how do you find you're not working?
If you just mentioned about the kid with the cut, if you hold it down.
Hold on a second. Let me repeat it again. Do not look at your book. If I know normal platelets is 150 to 450,000, and I know, and I realize that my patient have a clotting issues. My patient is not in any anticoagulant, and I find the platelet is so high. I alert the doctor. I said, yay, the blood result came back. Platelet result is higher than 450. What do you think? The doctor may want to order some more bloods. What do you think the doctor would order?
Complete blood? No. Complete blood count?
The doctor gonna order PT and PTT. So the doctor want to know the clotting factors. The doctor want to know the PT, PTT, and the PT and the PT, PTT. So now look at your PT result. Normal PT.
Okay. Normal PT.
Okay.
Mm-hmm.
What is your normal PT?
1 second.
13.5 seconds.
Read the answer. If I was you, let me see where you're looking at your answers.
11.
Okay, so now, remember I told you how to do it? Remember? When you see this, that's not where you to look. You gotta scroll up for me. Okay, so now, what is normal PT? Remember we talked about this?
Okay.
So now click on this. They give you an overview. Now you're gonna read this to understand it.
Okay.
So that means normal PT. Go ahead. Yeah. Okay. So now, you see, do you understand it the way you read it? Darling, hello?
Yeah.
Yes, I'm here. I'm here.
Come in this table, my love. You gotta sit here, babes. Yeah, so, okay, now. Do you understand your normal PT?
Mm-hmm.
What is your normal PT?
It's 11 to 13.5 within 14 to 19 seconds.
So now, I mean, what's that mean to you?
That means if you hold it down, like your finger.
Darling, are you guessing or you following what
You
the...
keep telling me not to look at things.
No.
That's the amount of time that we have for the blood to clot.
What is the amount of time you have?
That's between 11 to 13.5 seconds.
So now, I'm lost because it's PT and PTT. So we're looking at PT now. So if you're looking at PT, you tell me it's how many seconds?
11 to 13.5.
Second. What should happen between 11 to 14.5?
14.5, the blood will get clot. Blood.
Okay, so now, if the board of nursing asking you, Johnson fingers substandard cord and his index finger, it was at 11 a.m. What time you expect if you put pressure for the blood to clot?
Before 11:01 a.m.
Yeah.
What is it? Debbie, what is it? It's not a between, darling. The bottom thing is not going to give you between. What is it? You're going to add that 11 second to 11 a.m.? Okay, when you put 11 second to 11 a.m., what time is it? Okay, so that means if I put pressure and my finger or anybody that have the lacerations, I'm expecting the patient to clot between 11 to 14 seconds. If the patient don't clot, we have a problem.
Okay.
The doctor needs to intervene. So now the PT, and if you want to put it in a simple words, PT determine the bleeding process. If you keep on bleeding, the doctor said, I need a PT. What was the patient PT? Now, you said normal PT is how much?
11 to 13.5 seconds, which is 11 to
Normal
13.
PT I'm talking about. Normal
11
PT.
to 13.5.
Okay. So what about now we're going to look at APTT. Skip a page, please. APTT. Your APTT. Your computer is locked. Oh, I don't listen. What happened to your computer? You don't have the charge?
No, I do. I'm gonna need. Let me see the Wi-Fi.
You don't have it here?
No.
I changed company. They coming tomorrow.
Okay.
I changed company because they were robbing me blind. So, if you cannot log in, I don't, because I changed my company.
Oh, I see. It says Verizon,
Uh-uh.
my Alexis,
Mm-mm.
my Optimum.
I changed company. Tomorrow they coming.
Okay. So
Yeah, because you know what, they with my alarm, they wasn't doing too well because it's a sub company. They said I need to get Optimum or the real Verizon. So it's okay. So now, APTT. What is the normal APTT?
30 to 40 seconds.
The normal APTT. What is it?
30 to 40 seconds.
Okay.
25 to 35 seconds.
What do you find? 25 to 35 seconds. Thank you. The normal APTT is 35 to 32.
25 to
45 to 30, whatever. Go ahead. But did you went down?
Sorry, I'm getting to it.
Okay. What do you have?
25 to 30.
So we gotta read the whole thing. Don't only read this. They give you descriptions. What is it? Let me read it for you. Major takeaway. The normal range for partial thromboplastin time, which is PTT, is 60 to 70 seconds. You see, you're not reading. You see how you jump? So now, hold on a second. Now, remember we're talking about APTT. We're not talking about PTT. You're right. APTT is 25 to 30 seconds. But you gotta read the whole thing because there's a question of PTT. There's one for APTT. So now, major takeaway. The normal range for partial thromboplastin time, which is PTT. Put PTT on the next page for me. PTT is the next page. They call it partial thromboplastin time. Normal is 60 to 70 seconds. APTT, they said is mean active partial thromboplastin time. That's how they define it. It's 25 to 30 seconds. You're gonna need all those numbers to survive. Take your time, write it. If you don't study, I'm not responsible.
Wait, I see something that says without heparin 30 to 40.
What happened? We're not talking, darling, we're not talking about heparin. We're not talking about any anticoagulant. We're talking about values. Lab values. We're not talking about heparin, which is an anticoagulant. We're talking about lab values. Are you lost?
No, I'm not lost. I just wanna. I wanted to.
Okay. Where are you?
So APTT is 25 to 35.
Darling, APTT, what is it? Tell me what is APTT stand for.
It's the activated partial
Okay, so now you gotta write it there. APTT, also known, that's how you study, put it on the second line. Okay. APTT, also known as, then write the names. Because when you're on the board of nursing, they could only give you the names and you don't know what they're talking about.
Mm-hmm.
What is APTT stand for?
Active partial photometastic time.
That's it. Then we gotta know what it stands for, we gotta know the values. Okay, so. Okay. We know the PTT, we know the APTT. Make sure you know your values. So I'm gonna jump back to, we talk about platelets. Normal platelets is what?
Normal platelets is 150,000 to 450,000.
If it's higher than 450, what you suspected?
Stroke.
You suspected stroke because you're a nurse, you cannot say it's a stroke. You suspected stroke. The doctor could say it's a stroke. The reason the doctor could say it's stroke because the doctor is able to diagnose. We not.
Wait, can you repeat that for me? What did we say was before the stroke?
So now, normal, hold on, don't write. Normal platelets is 150 to 450,000.
Yes.
On the board of nursing, they may say it's 150 to 400,000. You got a parameters of 150 to 450. You're gonna look in your parameters.
Okay.
150,000 to
450,000. But the board of nursing have a lot of questions who stop at 400,000.
Okay.
So look, you have your parameters. So now, if it's higher than 450, I'm suspecting a stroke.
Okay.
That means the blood isn't clotting. The blood is clotting too much. That means it's producing too much clotting factors. It's producing too much clotting factors, right?
Mm-hmm.
If it's lower than that, the platelets is not producing enough clotting factors that we having a problem. Understand? It's a bleeding problem if it's less than 150. Less than 150, bleeding problem. So now, let's go to the, what other cells do you want to go to? Next page.
The white blood cells?
Let's go to the white blood cells. Next page, white blood cells. If you don't do your homework, it's not going to work. White blood cells. So what is the normal white blood cells? I believe is normal white blood cells.
So, because I always have a hard time with this one. So for the platelet, the only thing we need to know is the PT and AT.
It's not the only thing you need to know because this is something they do in A&P with you. So you need to know your lab values and you need to know what they stand for. So that's the reason I said to leave one page so you could continue and study them. Mm-hmm. So now, let's go to the white blood cells. The normal white blood cells is, what's the number?
I think it's 400.
It's 5,000 to 10,000. Normal white blood cells, look it up.
11,000.
Look it up. No, look it up. White blood cells and clicks. Normal white blood cells and clicks.
Yeah. 4,500 to 11,000.
Okay, so now I want you to listen. Hello, I want you to drill. Hello, darling. The board of nursing don't look at male or female.
Also just
They only look at black American and white. When we cross that board, I'm gonna tell you how they do it. 4,000, it's 5,000 to 10, but guess what? In some questions, 4,500 to 11,000.
Yeah, that's
Let me show you how you're gonna write it down. Okay, so you see? Hold on. You're gonna put a line here, you see? Here, I put Board of Nursing, BN, 4,500. And here I put Steady, 5,000. Okay? And then here I put, here again, I put BN, which is Board of Nursing, 11,000. Here I put Steady, 10,000. You understand? That's your parameters. 10,000. You understand? So I'm watching the Board of Nursing for 4,500 to 11,000. But I know I study 5,000 to 10. But I know I have this image in my head. If they come with an hammer with this, the 4,500, I got them. They come here with a hammer with 11,000, I got them. But I know in my head it's 5,000 to 10,000. You understand? That's the reason, sometimes I said people, if I feel like you have it's hard for you to understand, I said, maybe if you from Florida, Boston, whatever place you are, come for 3 days. Because sometimes you need to see. Some people, that's the way. Because, repeating things like this is not going to work. You got to understand. Okay? So now, if they said to me, okay, what is white blood cells? What is the job of white blood cells?
It's to detect when there's an infection.
That's it. So now look it up. White blood cells, responsibility in clicks. It's to fight infections. But sometimes white blood cells have a bigger workload than fighting infections. Okay?
Against infection and disease.
Wait, hold on. Perfect.
Inflammation as well.
Perfect. Don't even go that far. Hello? White blood cells, they are your protections. How? They protect you against infections and disease. What causes disease? And infections. If I don't treat pneumonia, I may die from it. If I don't, treat sign and symptom of TB, I may develop tuberculosis, which is a disease. I may die from it. You understand?
Yeah.
So white blood cells have 2 jobs, and I don't care. Protect me from infections and fight infections. Fight infection and disease. Because if you fight infections, you're not going to have the disease. If the white blood cells are not healthy enough to fight infections, I'm going to have a disease. You understand?
Yeah.
So now, let's talk about, listen to this. Normal white blood cells is 5,000 to 10. But I said to myself, the Board of Nursing is so tricky. They said it's 4,500 to 11,000. This is in the back of my head. I'm not looking for that answer in the exam. I'm looking for my 5,000 to 10. If I don't see it, I said 4,500. Oh my God, this is it. But if I see 4,500, and I look, I see 5,000, I'm going to go with the 5. Because this is what science says. You understand? They try to trick. The Board of Nursing is very tricky. Okay, so now,
Go with the standard, basically.
darling, you got to go with your little chichi. When you go home, if you don't take a piece of paper and redo that chichi, how are you gonna know it? You gotta redraw things. It's like you just listen. There was a Jamaican girl in my class. I was just learning the US. I came up here when I was 16 and I was only like 18 and I was at Bootsy's. That idiot speak English very well. I didn't know. The only way I say hi is a mosquito that bite me. But I know I can read. But I cannot talk. And then next thing I know, she came on, yeah, this is the way. I spent 3 hours in a chapter, she spent 30 minutes. And believe me, with my 3 hours, I know it because I have to detail every word. I have to look to the meaning. But I know my stuff. She ended up failing. I passed. Me and my friends who came to the US the same time, all of us passed. She fell. Now she's a nurse. She's an RN and she used to be in Long Island College hospital before they closed. I don't know where she's at. Her name is Roxanne. I don't know where she's at now. And she said, she will never. She said because of that experience she had when she met me one time, long time I never see her. She met me. I was in Long Island College Hospital as a manager for OB. And she said, oh, Marisena, after that experience, I never underestimated anyone. If you study, you don't care what people say. You don't speak English, you speak English. The only thing you need to have is comprehension, and period. Period.
Yeah, that's true.
Comprehension. If you have comprehension, if you have comprehension, and then with your comprehension, the way you're going to learn how to read fast, after you understand your contents, let me tell you, no one could stop you. I always tell people, don't let my English, that's the reason in my job. They always said, I'm the union rep. I'm not the union rep. Because I said to them, I said, don't let my accent fool you, motherfucker. I said, don't let my accent fool you. With my accent, I could take you, to court. And I said, I'm going to win. Believe me, I will. So everybody knows to stay away from me because of that. Yeah. So now, if you know that so well, you should be able to manage. Now I want to know. Now, if they say, listen to this carefully, white blood cells is my God, is my guardian against infections. If it's low, that means I don't have no guardian. They leave me. They go someplace else. They protect somebody else. What do you think should happen to me? If it's low, I'm susceptible of all kind of infections. It's low. When it's low, it's below 4,500. Okay. Hold on. It should be below 5,000. Because the board of nursing have some questions said the normal for them is 4,500 to 11,000. If it's below 4,500, I don't have no guardian. I'm susceptible to all kind of infection. So now, you want to protect your patients, right? So if you're susceptible for all kind of infections, it's because your white blood cells is low. Now, you want to protect your patient. How are you going to protect your patients?
Leaving them in in a room by themselves for negative pressure, or give them certain medication.
Bleeding precaution?
Is it platelets? White blood cell have anything to do with clotting factor?
Mm-hmm.
Oh yes, that's true.
Répétez caca. So now, that's the reason you need to know yourselves. If you know yourselves, you're going to know when they're talking about bleeding. Platelet is responsible for bleeding. White blood cell has nothing to do with bleeding.
Maybe antibiotics.
It's not. You're not a doctor.
Oh, okay.
Antibiotics is a last resort. As a nurse, what you're going to do? You're going to put your patient in isolation.
Okay, yeah.
You're going to minimize visitors. You're going to tell them if they have a cold, stay the fuck home. Wow. Don't come. Because they don't have the guardian. The white blood cell is done. They leave them. They don't have no security. The white blood cell is done. You're going to tell them, stay home, stay the fuck home, don't come. You have a cold, don't come. You have a fever, don't come. And even if you come, put some mask. Wash your hands. They have to mask themselves. They have to wash their hands. And how long you think they should stay in the room? Look it up. They shouldn't be staying in the room for a long time. Look it up. Okay? Okay. Okay? Let them stay. You know, how long?
It was.
You better go down.
I did.
Okay, so you gotta look and make sense in your head. If you don't find an answer there, you gotta go in a different way to look for the answer. Okay? So now, listen to this carefully.
Listen to it.
If you have, your white blood cells is your security against infections, is your guard, is your protector against infections, and the normal, according to Board of Nursing, is 4,500 to 11,000. According to scientists, is 5 to 10. Mm-hmm. So now, if they said, your security left you, you don't have no more people to fight for you, you and your own, you're going to hide. Mm-hmm. So how are you going to protect your patients? You're going to tell your patients, you're going to put a sign on the door said what kind of sign you're going to put. It's going to be an infection sign. Compromise because the white blood cells is low. Reverse isolations because your immune is compromised. Because your white blood cell left the party. They went party someplace else. They're not there. That means you're immunocompromised. You're going to have reverse isolations or the patient immunocompromised. My friend, you're going to put that sign on the door and you're going to tell the family, if you have a cold, please see the nurse at the nursing station before you go inside the room. Your job is to ask them, in the last few days, do you have a cough? Are you sick? Are you having a cold? Do you have the flu? Did you leave the country? Did you travel outside of the country? Are you just released from jail? Because when you go to jail, that's where you pick up all kind of nonsense. Mm-hmm. All right? So, when your white blood cells is low, the patient automatically goes on reverse isolation or immunosuppressed isolations. Because the white blood cells is no longer there, they're gone. They go party someplace else.
So, I still haven't found it, but are they going to leave them in the room until their white blood cells do come
So now, the doctor have two choices. The doctor have to investigate a little bit more to... Sometimes your white blood cells is low is because of the hematology system. Now they're going to look at your blood count. They're going to study your blood to see what's going on. Sometimes, when it's high, that's when the doctor going to start antibiotics because there's an infection present. When it's low, the doctor going to say, you know what, this patient is compromised. High, there's an infection, active infections. Low, you immunocompromised. High, you don't need to put the patient in isolations. Low, you do. Okay. So now, look to see protections for patients with low white blood count. What protections for patients with low white blood count includes?
It says no fixed time. The NCLEX will test your understanding that the
What
duration
interest?
for the number of days for the white blood cell low count. It says it depends on the patient's lab values, not a set number of days.
What do you understand?
So
now, what do you understand?
that it depends on their lab values.
Of course, but guess
How
what?
long
It's
they're gonna
low.
be in isolation.
They're gonna be doing it every morning to see is it going back up.
Yeah.
If it's still low, you remain in isolation until they resolve this.
Mm-hmm.
Because low white blood cell count, you immunocompromised, period.
Yeah.
If it's high, you don't need isolation.
No.
They need antibiotics.
Okay.
Okay? Because there's an infection. When it's low, there's no infection. They just don't know what's going on.
Okay.
Why the white blood cell leave you and gone? They want to know why.
Yes. I find a couple of things too. It says low white blood cells is an infection precaution to put the patient in a private room. And
Okay, Debbie, I'm gonna stop you right there. Debbie, I'm gonna tell you for the last time. Understand what you read.
Yes, I do. I'm telling you in my own word. I'm not.
Okay, in your own word, low white count, what it means?
It means like the patient is at risk for infection.
Of course, that's all. Because
Yeah.
white blood count protect you from infections. So, if you're gonna put the patient in a private room, the reason it's a private room, you're not gonna cohabitate the patients, is because you don't want anybody to bring anything to that patient.
Yeah.
But I'm gonna be very honest with you. The board of nursing will tell you the floor, you're in a med surg unit, there's no private room. What you gonna do?
You put the patient with somebody who's also immunocompromised. They're both compromised, so you put them in the same room.
You're gonna put the patient with someone who don't have any infections, or someone who has the same problem.
Yeah.
Guess what? So let's say the board of nursing said, in your units, you have a patient who's immunocompromised, white blood cells is low, and they said you have 2 patients to choose from to cohabit them. It's a manic patient who's that's not the time. It's a manic patient who's making noise, try to break the damn units down, or is a teenager who just have appendectomy done.
Teenager?
A teenager who just have an appendectomy done. Or a manic patient. Which one you're gonna put with that patient who's immunocompromised?
The manic patient.
The manic patient. Who you wanna put?
The teenager?
The teenager! The manic patient will bring the building down, will curse, will yell, you know what? When you're on a stage of healing, you want peace.
Okay.
That manic patient will make your life miserable. That manic patient will drive you out of the room. You will go out, asking for rescue, and you're going to meet someone in the hallway who have a cough, and you're going to get sick. The teenager have appendectomy. She don't have any infections.
And she was on the
And guess what?
antibiotics.
No, that's not the. And guess what? The teenager is busy on his laptop. The only thing he wants is his Nintendo game, his laptop, and his phone. Teenager usually don't need visitors. Come on, son. You gotta see who to put in the room with that person. Manic patient should be in their own, because if not, you cannot put 2 manic together. You could put a manic patient with a patient who is intubate. You know why? Because they're talking to themselves. The patient don't hear, they don't care. So now let's go back to platelets. What is your normal platelets? Mm-hmm.
350 to 450.
That's your normal platelets, right? So now, if the platelet is responsible for your clotting factor, so what isolation you think you should put your patient who have platelets problem? If it's low,
They have a bleeding problem.
they have a bleeding problem. If it's low, they bleed a lot.
Pride is suspected.
What, if it's low, we're talking about a patient, the board of nursing said the platelet is lower than 150. That means we have a problem. So where do you think you're going to put that, what precaution you're going to take with that patient? Look at the job of the platelet and you will know what to do. What the platelet does.
That's when I stop bleeding.
Okay, the platelet prevents you from bleeding from your nose, your eyes, your mouth, any opening in your body. It's a platelet that causes me and you sitting here, we're not spitting blood, we're not sneezing blood. We're not coughing blood, we're not shedding blood. It's your platelets. So if somebody platelet is low, according to the board of nursing, they want to know what precaution you want to take. Yeah, Miss, darling, please hold on. The doctor called you and said, you know what, Debbie, the patient platelet is low, please, precautions. The doctor will not tell you. The doctor just tell you precaution because you're a nurse, you went to school. He knows that you know what to do. What precaution you going to put the patient in? Debbie said bleeding precautions. I agree. But the board of nursing don't ask for bleeding precaution. He asks for specific thing. What you going to do? Bleeding precautions, that means if my platelet is low, don't you want the patient not to use a razor? If the patient the patient could use a razor. What kind of razor? Electrical razor. Electrical razor. If it's a simple razor, the patient cut his face, he's gonna bleed to death. And what else? The doctor will tell you, what about would you wanna do a rectal tip? No. Because if you put the thermometer on the patient anus, the patient may bleed to death. What about toothbrush? What kind of toothbrush they gonna use?
Soft Bristol.
Or electrical toothbrush. What else you think? What about when they're eating? What you gonna ask them to use? A spoon, no fork. Because the fork, they could accidentally poke themselves with a fork. What else? What about IVs? You're only gonna put IVs on that patient if it's necessary. When the board of nursing said the IV is necessary. When it's chemo and what else? And hydrations. Or antibiotics. Unnecessarily poking is a no-no. And what else? What else? You're going to tell the patient not to use anything, even his ears, not to use any Q-tips.
Okay.
Because accidentally, if you poke, blood. Understand? That's how you understand your cells. You got to know what they do. If you know what your cell does, their responsibility, easily you're going to come up with the isolation they should be on. Precaution or isolation. So now, let's say the set of patients have, listen to this carefully. They said, you, the nurse, on the 7th floor, and the hospital is full, but you have a patient who's admitting with bleeding precautions. They give you 3 patients. They said, who you gonna put, you're gonna partner the patient with? A manic patient who's throwing they're not going to tell you the manic patient is throwing the building, but you know that's what they do. A manic patient, they're going to put you with a manic patient or an elderly who walk to the bathroom, and they're going to tell you a pregnant woman. Who you going to put with that patient is bleeding precautions.
Pregnant woman?
Pregnant woman?
Okay, Debbie, why pregnant woman?
Because like we mentioned, like you said earlier, like when your body is fighting some type of
What the body is fighting? The body is not fighting anything. They're just they're not making producing clotting factors. Who do you put them with the who you If that's the rationale you have, that's not a good rationale. Who you gonna put with that patient?
Either the manic or the pregnant woman.
Okay, you gotta put them. No, you gotta give me one answer. Who you gonna put?
I'm gonna put the pregnant woman.
Who you gonna put? We have 3 patients.
Oh, the one to the bathroom.
Which one? The elderly was. Hold on.
Okay, I forgot about
Hold
that.
on. You have an elderly who goes to the bathroom. You will never have to put. The manic patient will go and beat up the damn patient. The manic patient is psych. You don't partner those people with anybody. You partner them with an elderly who don't answer. Because anytime you open your mouth, you said something, they said, you're talking about me, they will beat the shit out of you. So the manic patient will kill the outpatient. The pregnant woman don't want that stress. The pregnant woman who need to be in a room, in an OB room with OB patients.
Yeah.
But the elderly will just walk to the bathroom, go about her business, and go back to her bed. It has nothing to do with that bleeding patient. But that manic patient, he'll beat up the doctor, the nurse, and he will kill the patient. Okay? You gotta understand. Mimi, put your address down so I could have been send the book straight to you. I'm so sorry. Yesterday I was working there, but you gotta get the book Tuesday morning. Put your address here. So now,
Let me use this pen.
okay. So now we talk about platelet. We talk about red blood cells who play a major role in the body by bringing oxygen. By carry oxygen via the hemoglobin to the body, through your vessels, to your circulatory system, and also who provide nutrients and food to the cells that give you energy. If your red blood cells is low, if you don't have energy, what happens to you? Okay, when you wake up, you're tired, what happened to you?
You go back to sleep.
You're tired, you don't get up, that means you have a lack of energy.
Yeah.
If you don't have oxygen and bring nutrients to the cells, you're going to be weak. You're going to be tired. You're going to lose weight. You're going to feel like you're depressed. No? Let's do another cells. Next page, another cells. So there.
Skeletal. Or the epithelial.
Neutrophil.
Okay.
Let's talk about neutrophil because neutrophil goes with white blood cells.
Yeah.
Some doctors don't look at white blood cells to yell infections. Some doctors look at neutrophil. Now look for your normal neutrophil. Some doctors said it's the neutrophil they use to yell infections. They said they don't use anything else. So, okay. So, what is your normal neutrophil?
1,450 to 7,500.
What is it?
1,450 to
What did you
7,000.
read that, my love?
I got 1,500 to 7,000.
Darlene,
700.
what is your normal neutrophil?
Then it says
65
percentage.
to 75.
I don't understand. What is your normal neutrophil? I'm confused.
40 to 60%.
This is 55 to 75% of total white blood cells.
Darlene, that what do you know your total white blood cell? I don't know. That's all doctor's numbers you're talking about. I'm confused.
2,500 to 7,000.
Darlene, read about your neutrophil, okay? I'm gonna do two disease. Nobody, you know, you guys don't study. That's the problem.
It's coming at 1,500 to 7,000.
Okay. So when you come like this, based on what?
Microliter, cells per microliter. But the percentage is 40 to 75%.
Yeah, but you don't do those numbers because you're not the doctor.
What about the 55 to 75?
Of what?
It says 55 to 75 of the total white blood cells.
Darling, I'm not, you know, I don't know about the total white blood cell. That's the doctor problem. So I'm not looking at the doctor problem. I'm looking at my own problem.
2,500 to 7,000?
Yes. That's the number you need to know. Your problem is not the doctor problem. You're not there. You're not the lab technician. You're not the laboratory technician. So, darling, where did you go?
There's one right here, one right
Okay,
here.
where did you go? Where's the numbers you could click
I
on?
have put 1,000.
Darling, where's the number you could click on? The way I showed. Where is it? You see? That's not the way.
This is the top.
Okay, and
that's
then
the
go down.
bottom.
Keep on going down. Let me show you something. That's it. That's where you need to go. When you don't see that little arrow, that's not the way to go. Where's your arrow? That's your arrow, right? What is the normal range for white blood cell? Neutropenic precaution for inflex. What did you put? Neutrophil range. Hold on a second. Neutropenic precautions is for white blood cell. I'm sorry, you gotta put that. No, it's for neutrophil. Neutropenic precaution is neutrophil. Okay, the last one, 1.8 neutrophil is too low. Let's go in that last one.
Okay.